In this recording, I'm speaking to Jane Todhunter, who is a vascular nurse practitioner in Cumbria. What would you say is your experience of the culture within vascular surgery?
So I think you get a mixed experience and it changes depending on personalities within the team. But I think if you have strong leadership at the top, encouraging a culture of civility, then things tend to be fairly good. Now, we currently have one particular consultant who is due to retire very soon, probably within the next couple of years, and we dread him leaving because he very much promotes a culture of stability. His manner towards staff, his manner towards patients, and when he leaves, there's going to be a gap and we recognise that already. So currently, I would say my experience is pretty good. I have been a vascular nurse for quite a long time, and I think there is respect within the team for the role that we do. But the team changes depending on the personalities that come in and out.
Yeah, so when you say come in and out, you mean who are part of the team, but who's on at that time?
So not even, Lizzie. So sometimes you'll get locum consultants that come through who bring a different feel, or you may, like I can think of one consultant in particular who's left and works elsewhere now. And I can remember doing a ward round with him many years ago. And afterwards I said to him, I said, do you know, I said, I would hate any of my children to go into medicine because of how you treat junior staff. I said, you're so belittling and derogatory. And I don't know how anybody's meant to learn in this culture of fear and being questioned and being put on the spot within a large group of people. I said, it's so demeaning. I said, I would hate any of my children to go through that. You put me right off ever sending them to go into medicine.
And how did you respond to that?
Oh, they just laugh it off. They think you're being funny, and it's not worth the effort really sometimes to go further with that.
Yeah, well, good for you to stand up and say that.
I am, Lizzie. I'm quite forthright now, and I don't care what they think about me personally. And and I do very much. I feel quite protective of junior staff and nurses and even registrars. They can be so belittling at times in MDT meetings. But again, it depends on the personalities within that room that are present. Yeah.
Yeah, well, of course, and yet, I say of course, my sense is it shouldn't be like that, should it? If there's a way that people are taught and trained and told they should behave, then they could all behave like that.
Yeah.
And obviously some do, and some just feel that's not for them or not important.
And I mean, you do see both sides, because you do see junior staff who are not so engaged, and that's really frustrating. When you go and do a ward round and you don't have that engagement from junior staff. But, snapping questions at them, undermining them, that's not going to help anybody learn or think or answer correctly. And you come up against, then you get those sort of allegations of bullying and harassment within vascular, and you think, well, no, I do see both sides, but there's a way to. We have a different culture of youngsters. We have a different culture, and they won't tolerate any of that, and nor should they. It's difficult. I do see both sides. High pressure environment, you do need to know about these patients. We are here to learn on a ward round to find out, and you work with these patients, but sometimes there's just not sufficient engagement from junior staff to make that run smoothly. But then they have to learn how to do that, and I think they have to be supported.
That's the thing, isn't it? That you, like you said, you're not going to make people more engaged by yelling at them or humiliating them, making them feel small.
Yeah.
They need encouragement, and they need telling, but not in front of 10 other people.
No.
In a cross way. So I think, but I totally see how you can see both sides of it, and I think that's really interesting as well, that we need to find a way to realize that not all what sounds like criticism is bullying.
Not at all.
But there is, and there is the no, you need to know this. That's
absolutely
from a humiliation approach.
Absolutely,
and it's like teasing that apart, isn't it? A little bit.
It is, yeah. If I have patients that I want to discuss, I can go to any of them to discuss. To be honest, they're all the consultants I work with. There's only one who's a very strong personality, but that doesn't annoy me because I can be equally strong back. That doesn't faze me. But that's difficult if you're in a junior staff, and I think that's one of the. It's a funny boundary, really, when you're a vascular nurse specialist. You're not under their management, But I suppose in one sense, they do respect what we do. But when you're a junior doctor, it's a very different dynamic. It's a very different dynamic. But we do foster learning, and we do have a culture of learning. And there's probably just one very strong personality within that who would sometimes be a hindrance, but not always. Not always. The consultant that's going to be retiring, he is an excellent mentor, and he does foster an environment of learning and support. He really does. And if you're in a clinic with him, you learn. If you're doing a ward round with him, you learn. You're not afraid to ask questions. You can have those discussions. So we done some civility course a while back. The hospital ran it to try and change culture really and promote civility. And a lot of the things that they were saying, you could sort of relate to this, like using banter as if it's okay, but actually you're belittling me by what you're saying in that banter.
Yeah.
And just almost childish things like mocking, mimicking accents, or just I mean, it could be funny, but it's not funny really. In the context of a professional environment, that's not funny.
Yeah, if your best friend said it to you, that would be okay.
It's different, but, yeah. Yes. And yeah. I do have a really good sense of humor, and I can laugh things, and that's not a problem. But not everybody feels the same way.
I've been doing some recordings. I don't know if you've heard any of them, but somebody said that he felt that he was a senior vascular surgeon, and he said that he felt that there are behaviours that are needed in the operating room, probably like 1% of the time, when there's some life-threatening bleeding going on.
Yeah.
But then that behaviour gets extrapolated beyond that moment, and then beyond the operating room, and it's just unnecessary. I feel like it's a conversation that really needs to be had more openly.
Yeah. I think too, as a hospital, as a trust, they have really tried to promote civility training, and they have given us some tools. And I probably wouldn't be afraid to say to somebody, why did you say that? Do you think that's helpful? How do you think that makes me feel? Or how do you think that? And even, I suppose you become brave on behalf of other people sometimes as well. Like, hold on a minute. Was that really a helpful comment to make, to your junior doctors? Sometimes it's frustration because they do demand a high standard, and it's frustrating when that standard's not met. And it's about patient safety. They say at the end of the day, the consultants want the best thing for their patients. And sometimes if junior staff aren't meeting that expectation, it is frustrating. It is frustrating. And it's been managing to control that frustration and make it productive rather than antagonize things and make it counterproductive, really, I suppose.
Yes, but do you also think, it really strikes me that in a team where you really trust each other, if you are then frustrated with something somebody's not done, you're going to be able to say it, and it's going to be heard in a different way from if you're constantly criticizing or whatever. So it still isn't helpful. It might be frustrating, but to kind of keep letting your frustration come out as kind of is not going to get you anywhere, whereas building a relationship with those people is actually a much better long-term strategy.
That all sounds very negative, but actually there is a culture of support and learning. And I think because we're a smaller centre, perhaps there's more crossover with consultants for that support. So on the whole, it is very positive. It's not all negative. It's just there are those occasions, and I'm hopeful that things will change. I do hope things will change. And you used to have that thing where consultants were, when they were junior doctors, I remember being treated so awfully, and that sort of perpetuated in their behaviour sometimes to others. But I'm hopeful that is actually swinging, and the fact that the Vascular Society are looking into this is really quite positive.
Yes, isn't it? This is the thing that I kind of want this project to be. I've called it the Rising Tide Project because I think it's about, as you get people involved, as people start to see, oh, there's somebody talking about this. It must be the majority of people that want to work in a civil, supportive, caring environment. And then there's a few outliers. But because the outliers are noisy, they kind of dominate. And then you go, oh, I can't do anything. I can't say anything. Too risky. Won't be heard. And then nobody does. So I feel like this is an opportunity to just kind of get all those other voices out there. Is there anything that you'd like to see happen within this project, or that you're kind of thinking, oh, I hope they're going to do this, or I hope the outcome will be that?
I think it's feeding back how it truly is, because we all think that we know how it is, but we never know how it is for other people, do we? And I only know how it is for me. don't really know how it is in other places. So I think it's about, well, actually, these are the issues. This is very real. These are the issues, and I'd like to think it's dinosaurs that are going to die out as they retire that promote this sort of culture. But I don't know. I actually don't know the answer to that. I don't know if you can address it exactly what you're doing with those early consultants, with those trainees, if you can address it at that point and really get them to adopt this culture of good behavior really within the workplace and promoting it.
Exactly. And like you say,
So,
people don't know what it's like in other teams. And I think,
no,
I spoke to someone yesterday who's obviously surgeon working in what's a wonderful supportive team. And then you
yeah,
speak to somebody else who isn't, and it's quite sort of siloed. One team can be like that, then
yeah.
then you want to be sharing that experience with others.
So yeah, it's about what has made that team so cohesive and supportive.
Yeah.
It's like what are the things that we can share from this that you can be embedded into other teams across the country, really.
Yeah. And one of the
Um,
things that I really want to help people to get to is that we're all making a difference all the time. So you can be, the most junior nurse in the team, and still the way you conduct yourself is going to make a difference.
yes,
And it feels
yeah,
like, oh, well, I'm helpless. Well, I'm helpless. And everybody kind
yeah,
of feels like they're helpless except for this one noisy person who's throwing their weight
yeah,
around. Well, then
yeah,
nothing changes. But if everybody kind of went, oh, no, we can all be different, then I
yes,
think
yeah.
culture would start to change.
And I think it's about just empowering them to do that as well, isn't it? It's like these are the things you can say in these situations that will actually help you change outcomes, but not be antagonistic. You just simple things that you can do when you're faced with somebody who's belittling or demeaning.
Yeah.
Rather than bring against it, like, oh, I'm going to bring harassment against you.
Yes.
Simple things you can do in that situation. So it's like almost give us some tools that we can use to empower us to deal with that. Because that feeling of being helpless is so difficult, isn't it? And that's one of the things I'm sure would make people leave teams if you feel helpless within that situation. But if you can come through this and think, well, this is what you can do when you're faced with this, I think that would be really helpful.
Thanks very much to Jane for this wonderful conversation and these helpful suggestions. If you'd like to be interviewed for the project, or if you've got any ideas or suggestions, please do get in touch.